Hey, what's up guys? So I've had this idea for a little while. In addition to having a vlog where I show you a little bit about my life and what life is like for surgeons, I want to start making some videos where I teach you a little bit about the skills we use in the operating room and the skills that let us do what we do. So if you're pre-med or you're in med school or you have any interest in ever going into medicine or surgery, this is going to start teaching you some of the basic skills you need, like how to suture. And if you don't plan to ever go into medicine, but you're just curious, I'm hoping that this will be interesting for you too. So in today's video, I'm going to show you some of the basics, like some of the instruments like these, and this, and even this, which is suture. As we go along and I make future videos, I'm going to ask what you guys want me to do, because this is going to be made in part with you. I want to make videos that you're interested in and teach you guys things that you are curious about learning more. Oh, and one other thing, at the end of this series, I'm going to be giving away the equipment that I'm using to show you how to suture. So make sure to click that notifications button so you'll be the first to find out when I give it away. All right, so let's go. So what I have here is the bare minimum that you need to suture. So you need one of these to hold the needle and pass it through the tissue. Most people call it a needle driver, although technically the word is a needle holder. You need these, which are forceps. This particular forceps I'm holding here is called an Adson forceps. But basically, you're gonna need one of these no matter what kind of suturing you're doing to help hold the tissue that you're suturing through, and also sometimes to position the needle into the needle driver. So that's the second thing you need. And finally, the last thing that you need is suture of some sort. Now this is just one type of suture. There are thousands and thousands of different suture types out there. Now, when you load the suture on the needle driver, you need to position the needle the proper way so that the needle will be aimed to go through the tissue the way that you want. And I'll show you what that means. Typically, you want your third finger and your thumb just the tip of the way through. When you hold the needle, you're going to want to be holding it about 2/3 of the way down the shaft. And when you load the needle, you're going to want anywhere from like maybe a 15 to 30 degree angulation. And we're just going to start with what we call a simple interrupted suture. So first I'm going to lift up the tissue, take a bite, notice how I'm rotating that needle to bring it through, picking up the needle with the forceps, grabbing it on the other side, pulling the suture through, taking my second bite, and now I'm going to prepare for what we call an instrument tie. All right guys, well that's it. Thank you so much for watching. And let me know in the comments section below what other skills you'd like me to teach you. I'm planning on having different types of suturing techniques, probably having some types of knot tying in there and things along those lines. But if there's anything else that you'd like me to show you, let me know in the comments section below. All right guys, I'll see you in the next video.